Yeah, Bhavatharini, the question to you is, I know of how much, little bit I struggle, but a lot you struggle to go to the ministry, approach them, get them to declare 10th March as the GDM Awareness Day. What was the, effort involved in that? And having declared that, okay, all of our champions have got together doing something special on that day. Do you think it has made a difference, and how much more we need to do? Bhavatharini? Because the whole buzz around here is, let the women know. Let them know, let them be sensitized to the fact that this is an issue. They have to come up for the test, and they have to demand the test as if it were from the clinicians. Bhavatharini? You're muted, Bhavatharini. Yeah.
Actually, on seeing the difficulties in the older procedure, what the government felt, it was very difficult to screen a huge number. If you see the rural side, that forms the backbone of our country, who have to be concentrated. With the older procedures, it was very difficult and confused whom to screen, how to screen, how to when to screen. All these problems were there with the rural people. I was going around throughout the Tamil Nadu, seeing to all these difficulties. After the introduction of the single-step procedure, the government is much pleased, because it's very easy, economical, and they were able to screen all the women. Because of this, they wanted to honor our founder, DIPSI President, in some way. But still, you were the one who are instrumental in predicting saying Sir's name, his birthday, to be practiced as GDM Awareness Day. You only gave the first idea. After this, only the all started, along with Dr. Anil Kapoor. You both were so instrumental in insisting that government, of course, wanted to make some awareness among GDM women by considering this day GDM Awareness Day. And after that, it was very easy for us to go reach the government. Maybe me, myself, Dr. Purandare, Dr. Rajiv Chawla, Dr. Rajesh, we all went again and again and said about the advantages of this procedure, which is very much accepted and appreciated, especially in the lower socioeconomic groups, where they have been so far. They have been not done. They were not undergoing any test and facing all the consequences. And as Dr. J.M. Kannan said, after adopting the single step, it was so easy for the whole government side. I'm saying not about the 5 to 10% of persons who are not following our procedure. They are very much convinced, and they were following and doing this in every universal. When they came to about the national guidelines that all has to be tested, and it's in the very first visit, that is in the first trimester, with the single step. It was so easy. When I went after that, for some time also, they said, you do whatever want you do in GDM, but don't change our procedure of DIPSI. They are so much happy with the procedure. And so the government is also very much happy to honor our president by celebrating his birthday. And you know, in pregnancy, if you ask them to come again for the second visit, they are all coolies. They have to get permission from there where they work. And if you ask them to come again, if they just don't come the very next week or something, they choose their own days. Then what happens? The fetal handling starts, and you may miss the diagnosis also. And if at all, if she happens to be a GDM on that visit, it will delay and it will increase the morbidity, like how our sir says now, that once it has started, you cannot stop. What he says is to prevent. So it has to be caught in the very first visit. And being pregnant, they don't come alone. They are always accompanied by another person. So these lower socioeconomic ground reality, 2 wages of God. They don't want to lose their income in another day. So they may not turn up at all. As you said, there are many dropouts. So, and another thing, as Kasturi Madam said, it is not only this test we are doing in pregnancy. We have plenty of other tests to be done. And we cannot spend the whole day for doing this test, taking 3-4 procedures. And even if you have asked them to come again in fasting, the hypertonic solution, they are not able to tolerate that hypertonicity of the glucose solution. They vomit. all the efforts of putting them to asking them to come in fasting goes waste. All goes waste in many a times. Practically, this happens. So, as far as the government setup is concerned, where there is scarcity for everything, they always welcome, which is very simple, easy. At the same time, it should be very useful for the community, patient as a whole. So it's a very happy, they welcome all this, and it is very easy because I go around throughout Tamil Nadu, I find this, they are very happy. And again, I want to say, rather than saying that we are 11% more prone to get diabetes, nowadays it's a single child, she gets married very late and further delays the child, and the age of occurrence of diabetes is coming down. So what I say, every pregnancy is precious.
Yes.
So we have to consider all these criteria, what we have given well ahead is very much useful and everybody accepts.
Yeah. And then not only that, the government has wholeheartedly accepted it, and those who are doing it have felt the ease of doing and also have discovered a lot many more cases in their own practice. And it's been an eye opener to them. So many, years we didn't do, and we have probably missed some cases. So that is the change in the mindset and attitude. And I think the awareness day goes a long way. Like Father's Day, Mother's Day, it's a big buzz that is created. And that is what is also the need to reach the public onto a fact that the diabetes in pregnancy is real and it's big in our country. And so better wake up to this fact and do your best and help your doctor do their best. So that is how the Awareness Day sensitization has come about. So thank you so much, Bhavatharini. Not only that you've been instrumental in many things, but you are a constant pillar of support for Dr. Sheshaya, taking care of every of his travel needs. And only because of you, if Bhavatharini cannot travel, then Sir cannot travel. It's almost become like that. So thank you so very much, because
thank you.
That is another extra mile that we have gone to support the stalwart in this field. Thank you so much. So
gifted to have that, madam. I have that gift.
Yes.